Today is the 2nd of July 2020.
Okay, this 20-year-old female red ear slider came in because the owner diagnosed the slider as having problems laying eggs. Medically, it's called egg binding. Egg binding means that the eggs are stuck inside the uterus, and because there's no contraction or weak contractions, the red ear slider cannot lay eggs naturally. Now, according to the owner, she diagnosed the eggs as this one. There's a big swelling here, and another big swelling here. So she diagnosed that this red ear slider had egg binding, which is a correct diagnosis in the sense that we took up the x-ray. We had an x-ray of this red ear slider, and the x-ray shows that there were 2 eggs inside the body. Now, as you can see, it's more on the right hand side, but it's nowhere near the vent. The vent, because the swelling was here. The owner feel the swelling here and here near the tail, but these eggs are far in. So those 2 swellings were not eggs. They were probably the pelvic bones. As you can see, there's one swelling here and one bony structure here. Okay, so x-rays is important, so we took the x-ray, and there are 2 eggs inside. Now, according to the owner, this red ear slider had never laid eggs in her life for 20 years. Now, normally the red ear slider lays eggs about 4 to 5 years of age, and that's a female. And in this case, it's a very rare case of a red ear slider laying eggs at 20 years of age. So veterinary medicine is very interesting in the sense that you see very unusual cases sometimes. Now, I put it upside down, and she should normally turn upright within 2 minutes if she's healthy or active. But as you can see, she's not very active, but she's not lethargic. Okay, so now you can see the swelling still here, but as you can see in the x-ray, the eggs were nowhere near the vent. This is the vent, the area where the eggs are laid, the opening. Then this is the vent. Okay, the opening is here. Yeah. Okay, now, although you see the 2 swellings here, they are not eggs. That's because we have already given injection, and I did inject at about noon time oxytocin, which is a drug to stimulate uterus to contract, and when it contracts, the eggs are expelled. Okay, and then I give calcium as well, because sometimes there's not enough calcium, and so the uterus cannot contract. Now, these are my 2 standard treatments. Of course, some vets, they just use oxytocin, and that will work as well. Now, the dosage of oxytocin in this case, because I don't know exactly how long it had been having trouble laying eggs, so what I'll do is I give a bit higher dose. Normally it's 10 IU per kg. In this case, I give 15 IU per kg. I use international units of oxytocin, and for calcium, I give 0.3 ml of this diluted in normal saline. I give under the skin. It's shown in the other video, under the skin, and 2 sides. Distribute it under the skin, and I did expect it to lay eggs in around 2 hours. So 2 hours later, you can see that the red ear slider did lay eggs, as what is shown on the x-ray, and the eggs are 2, and 2 eggs are laid. So that is good news for the owner as well. As you can see, This is a longer oval shape eggs. Yeah, because of the angle, actually it's longer because it's probably oblique angle in the X-ray. Yeah? And this is a spherical one. And so the two eggs are laid and there are no more eggs in the uterus or in the body. So that is good news. And this is the outcome of the use of oxytocin. Without oxytocin, no eggs will be laid and the red ear slider would be lethargic later on when the eggs rupture. So the owner is happy. Now there's another method of treatment. It's called ovocentesis. Now ovocentesis is if the egg is stuck quite near to the vent, about here, and you can feel it. You can feel it in other cases. Then when you take an X-ray, the egg should be seen quite near here, the vent quite near here. So with that, we have the confidence. We have confidence to go in, put the needle inside into the egg, and suck out the egg yolk. So when we suck out the egg yolk, then the egg collapse, the eggshell collapse. So what we do is just use a faucet and pull out the shell, and that solves the problem of egg binding. That is also called egg binding, and that is another method of treatment. So I shall conclude now that always X-ray the red ear slider when they have dystocia problems, difficulty in laying eggs, and the X-ray will tell you how many eggs there are. Normally it's the dorsal ventral view, and then the other advice I would give is best is to use combined oxytocin plus calcium. Although oxytocin does work sometimes, if you find that the eggs, the dystocia conditions, difficulty in laying eggs has just started maybe just one day ago or a few hours ago. But if you don't know exactly, it's still the best to use oxytocin. Minimum is 10 IU per kg, and calcium injection subcutaneous. This ends the educational video, and thank you for watching. How many minutes is that?